Thank you. So what I'm going to talk about is what kind of plans and efforts Norway has been has done the last 10, 15, 20 years, and also tell a little bit about the lessons learned in Norway. So we have been dealing with homelessness in Norway for quite a long time, actually. But just to have an introduction to the topic, I would like to share with you news from the first time when the founder of Housing First, Sam Semberis, visited Norway, because at that time he stated that Norway got all the opportunities to end homelessness within 2 years. He meant that Norway has the resources, the competence, and also politicians who want to see changes. And I think Sam Semberis was quite right when he stated that, because we are a rich, wealthy country, a lot of resources that is sourced into the services. We have competent people working with the homelessness, high educational level, or most of them. And I think no politicians would like to say that he or she doesn't want to see changes when it comes to homelessness. Having said that, I think it's a big step from saying it to doing it, actually. So do we have the willpower to end homelessness? That's quite another question. When I meet people, social workers from other countries in Europe, they tell me all the time that you mustn't end or change your welfare state systems because it's so big, it's so important, and we see all the shades of not having the same kind of welfare systems that you have in the Nordic countries. And I remember Mike Allen, the former president of Fianza, said, look to the Nordic welfare state during a big conference some years ago in Europe. And what he meant was actually that the strong basic services that we have developed in the Nordic countries prevent people from getting homeless, but also help them a great deal to dealing with the homelessness. Having said that again, we had a big national service done last years in Norway that was examining what kind of well-being the Norwegian population had, also compared to other countries internationally. And not surprisingly, Norwegians feel quite good, are quite satisfied with their life. But there is a group that is far behind the others. And that's the group of people living on the social services. That group, compared to other countries, is at the same level as poor countries you can find in other places at the earth, in Africa, for instance. And I think we have to remember that the gap between the average population and the people that are excluded is quite big. And what it does with these people, you know, their well-being and their confidence is quite alarmingly, I think. So, just a little brief information about Norway. Like the other Nordic countries, we are using a great deal of our expenditures on the social welfare system and the health system. And compared to other countries in Europe and in the world, it's quite big numbers we are talking about. And of course, that underlines what I said earlier on, that we're talking about welfare states that have strong basic services, serving a great deal of the population when they are getting to crisis or hard times. In Norway also, we have a lot of detached houses. That means in separated houses where people are living for themselves. We don't have many big cities with blocks tower blocks and so on, with many apartments. We have some of them, and most of them in the big cities that we have. I think also it's the homeless situation, and the dealing with the homeless situation is not something that appears in a vacuum. We have to look back at what we have done. And in Norway, I think we have done very much the same that you can find in other Nordic countries. There was a great deal of homelessness after the Second World War. And at that time, the Norwegian State Housing Bank was established that actually has dealt with homelessness and social housing problems from that time to today. So that's an important body, organization, also dealing with homelessness. During the 70s and 80s, we had a lot of criticism of especially the systems in mental health and drug addiction field, because we had a lot of institutions that time that was put down, and gradually the municipalities got the responsibilities for all of the citizens. And that was something that is quite important today as well, because it is the municipalities where people are living their lives that the solution should be found. At the late 90s, we had the first homeless survey carried out in Norway. I will talk a little bit about later on. And also we had the first national upscaling plan for community-based mental health. And that plan was quite important because a major goal in that plan was to establish houses for these people. That was perhaps the most significant aim of the whole plan. And that was something we succeeded in Norway with. And also during the last 20 years, we had a lot of strategies and plans to follow up the homeless situation that we have in Norway. And I will talk a little bit more about the last plans, the National Strategy Plan, Housing for Welfare, and also the Upscaling Plan for Drug Addictions, that both of them are telling a little bit about how we deal with homeless situation. But before I move on, I will also mention the National Strategy Plan for Quality Improvement that started up 15 years ago. That is an important plan because that plan very clearly stated that the services should look upon what we know as knowledge-based services and practices. And that's something else than what you find up yourself or what you traditionally do. So, a little bit about what has been going on the last 20 years. After the first national countings, it was started up a program in the major cities in Norway with a key goal to develop different kind of service models. And as usual in Norway, you will see a huge variation from municipality to municipality, how they deal with these things. So there is no standardization. And that's a problem, I think, in some areas in Norway, because you have actually some traditional services that are not functioning that well, and they don't look upon other municipalities that has done quite well with it. Having said that, I think one key findings from that period was what we call the normalization model today, which is a fundamental principle that everyone, regardless their disabilities, can achieve a stable housing as long as they get the services they need. So no matter what kind of disabilities, social, physical, or mental you have, you can live in your own apartment and should have the opportunity to do it with the services that is required. And that's a key principle that is also important today. After that period, we had the National Strategy Plan called Pathways to a Permanent House, which was a strategy that was meant for all municipalities in Norway. And the key goal was to reduce the numbers of evictions and also the use of temporary accommodations. That was very important because we had a huge use of these kind of temporary solutions at that time in Norway. But it also had a greater, I think, focus on what we called user involvement. So users should be seen and heard and take part of the decision making when it comes to what kind of housing they need and also what kind of services they need. And it also emphasized the user involvement and the normalization model that was established earlier on. After that, it was between the national state bank, Husbanken, and different municipalities. It started up so-called social housing development programs, where the municipalities tried out different kind of models, services towards this group of people. And that is a partnership that has been going on until today. And I think it has brought the municipalities a great deal of experiences and knowledge that they're using today to deal with homelessness. And some 7-8 years ago, the first Housing First program started up in Norway. And in Norway, like other countries, the results are very good compared to the other kind of models and services that you can find for the same target group. We don't have any ACT Housing First teams in Norway. Only case management model is carried out. And with multi-professionals working in the teams, but they do a lot of work also collaborating to other services when you don't have these ACT teams. So all these efforts has led us to a reduction in the numbers of homeless people in Norway. So it was quite a stable numbers, around 6,000 people from 1996 to 2012. But from 2012 until 2016, it was reduced by 2,000 people. And that's quite a big number. But having said that, it also has been mentioned that many of the people that are experiencing long-term homelessness, and most of them have severe drug addiction, at least 80%, and also 50% with mental health problems, the numbers are the same in 2016 as we can find the formerly years. So what are the reasons for the reduction? In the report, it states that 20 years of social housing programs systematically done has brought fruits, has brought good results. It has been a change of attitudes, and that's quite important because homeless people now are seen as human beings without a home, not as individuals with a clinical or social problems that should be solved. The clinical and social problems, of course, are theirs, but housing is a permanent need and a basic human need that has to be solved before all the other problems. So having changed the attitudes means that we are looking for houses much more focused than perhaps before. And also, this has not been something that has been done overnight. It had taken years for many of the municipalities to deal with the problem. And also Norway, with its good economy, its growing economy, of course, the economy has an impact on what we actually can do and not. So we didn't experience the financial crisis in 2008, for instance, and also are dealing quite good compared to other countries in this specific pandemic situation we have today. So money helps, of course. A little bit about the strategies, Housing for Welfare. It was started up in 2014 and ends this year. There are 6 different target groups in this strategy. And one of the most important target groups are persons with drug addiction and mental health problems. But most of these people have other kind of problems than that. Approximately, we talk about 150 persons, more or less. And among them, as I mentioned, 4,000 homeless persons. In this strategy, homelessness and the situation for homeless people are mentioned several times. And there is an emphasis on prevention, how to get houses, and also what kind of services and the array of services that are needed for this group of people. We talk a lot about prevention versus repairment. You have to deal with both, actually. You have to stop, more people getting homeless. On the other hand, you also have to deal with the homeless situation. I think most attention has been given to dealing with homelessness than actually ending it. So there is no clear zero vision, for instance, for these people that states that we should have no homelessness in Norway, at least long-term homelessness. The aim of the strategy says that everyone shall have a good place to live. We shouldn't have temporary housing unless there is a crisis situation. So going on from temporary to permanent housing is a goal for this strategy, and it follows up the strategy goals that we had earlier years as well. And everyone in need of services shall receive the help they need to manage their housing, prevent evictions, but also have services that actually can live the life they want to live with the help from the services, the people that follow up, and so on. Also, so they can keep their house. And also, the public effort should be comprehensive and effective. It's talking about a holistic planning here, because this is problems that are quite complex, and it needs an effort from different kind of services, but also different kind of departments at a structural level. And this very much is in line with the actual law that says that all citizens should get the opportunity to live independently and have an active and meaningful existence in community with other people. So we talk about houses and services are separated, and the services follow individual, not houses. So if you lose your house, you still get the services. It's not something that is attached to the house. That's an important principle in this. There are 2 reports that tells us about the evaluation of the Housing for Welfare program. The second report isn't published yet, so I only had the findings from the first report. And it states that the majority of all these target groups have a stable and permanent housing. But there are a few changes from 2014 to 2018-19. So that means that the group, especially with drug addiction and mental health problems, hasn't changed much in numbers, and also their problems are very much the same today as it was in the beginning. There are a reduction of families with children in temporary houses, but there are at the same time an increase of young persons with housing problems. I think the strategy has emphasized the importance of policy and leadership, good policy and leadership. And there are more local ownership now to dealing with homelessness than it used to be before, and also dealing with this quite diverse target group that we are talking about. The local plans has been updated, and there are some social innovations going on, programs, services that try out different ways of working with this group in different kind of municipalities. And it says that there are more user-oriented services today than it used to be before. But I think it's right to say that in Norway has been established a lack of tradition of thinking social mixing. You know, who can live together with who? That's something that we find very hard to liberate us from, because we think that people with drug addiction, mental health problems should live together and so on. But that's not something that's actually helping them in their recovery way. That's something we know very much about. The strategy has some important goals. It says that 80% of persons with drug addiction and mental health problems shall have a stable and permanent housing situation. 90% of persons with mental health problems shall have a stable housing situation, and 80% of persons with opioid replacement therapy should have a stable housing situation. So what are the figures? Well, if you compare 2014 to 2018, there isn't much changes, as you can see. So approximately there are the same amount of people with mental health problems today that are struggling with their housing as it was in 2014. And the same has to be said about drug addiction and mental health problems. Actually, there are fewer today in this statistic. And also a little bit of increasement when it comes to opioid. But the target was 80% and 90%. So we are not quite there. We haven't achieved the aim that we set at the start of this strategy. And that tells us a little bit about how difficult this actually is. The other plan that has been carried out and ends also this year is the escalation plan for the field of drugs and addictions. And user involvement was a key goal in this strategy. Let the users themselves, much more than earlier on, decide where they should live, what kind of apartment they need, and also what kind of services they actually need should be strengthened much more today and highlighted than it used to be before. Earlier on, people were given some kind of opportunity to the first free apartment, council apartment, for instance. But one is trying to change that kind of attitude, that culture. And also, it's very important to identify and help people at the early stage. We know that's something that actually is very important also for the recovery process. And also, how to live an active and meaningful life is something that is focused on in this strategy. And again, people have different choices, different meanings in their life. So we need a variety of opportunities, and the staff need to explore these kind of opportunities with the users. So homelessness is mentioned several times in this plan, but homelessness is not addressed as a prioritized target group. It doesn't say that now, today, we should get rid of homelessness. So it covers more or less from prevention to actually deal with people with long-term homelessness. And the focus is on user involvement, staff and services. A question is that should the strategy be more specific about the numbers, like it was in the upscaling plan for the field of mental health? Because that plan stated very clearly that we should establish at least 3,500 houses for these people. This plan doesn't say the same. So the evaluation so far tells us that there are a growth of numbers of employees. So more staff are working with these people now, and also a growth in the competence. We have more outreach teams today than we used to. And also the housing situation in general has improved, but there are still some challenges to in the access to suitable housing, especially for the most vulnerable group. And also, it says that it's quite difficult to find good solution for this group of people, especially people with mental health problems, severe drug addictions, and perhaps also has some kind of behavior that is not easy to deal with. And it states that it's very hard to prioritize these target groups because you have other groups that also are knocking at the door and needs help. And it also is a concern that the initiatives that we had during this upscaling plan period ends when the period is over. And also some problems in the collaboration between the services. Also, in this plan, the plan has increased the ownership that we can find in the leadership and in the municipalities, and that's quite good, although there are major variations between the different municipalities. And also, there is some kind of social innovation going on with this plan that tells us that we try out different models, different ways of dealing with homelessness. And also, mapping studios such as Brukerplan has become quite crucial for the development. So we're using, this kind of knowledge and data more than we used to before. A little bit about lessons learned before I finished. So there are many good intentions here. But I think perhaps some of the results are blurred. They're not quite clear if we have achieved what we were set to do, actually. Dignity for all citizens, of course, that's very important. And what is dignity, you can ask? If you ask the users, at least a place to live, a decent, good place to live, is dignity for me, many of the users says. And still, not all the users actually have a place to live. So we are not quite there. And also the user involvement, the shared decision-making process is something that is very good in some services. Perhaps others are struggling with it. The focus on meaning, resources, and activity, the humane aspect of this strategy is quite important. It's very difficult to have results on this. Who should you ask and what can you measure? Meaning is so different from person to person. So it is a tendency that some of this, the good intentions are words that are spreading in the air. It's very difficult to, take it down and have some kind of concrete fulfillment. And also, I think we are not quite there when it comes to an inclusive society without prejudices and stigma. What we actually have done during this time with this strategy is we have restructured a lot of the health and social care systems in Norway. We have major reforms related to mental health, drug addiction, work and activities. We have established day and activity centers in almost all municipalities. Some municipalities have many of them for different target groups. We have lots of new local-based services, both services that are working with prevention, but also services that are following up people with long-term problems. And also there has been gradually a change to look into the knowledge-based models and methods more than it used to be before. And very importantly also, we have peer workers much more into the workforce today than we used to earlier on. This model says something about how we traditional thinks about social housing. And at the bottom level, common houses in ordinary neighborhoods, that's the normal way of thinking. And when you ask users in general, most of them says that, yeah, common houses in ordinary neighborhoods is what I need. Also people with severe mental health or drug issues because that's the place they can relax, be themselves, withdraw from the tense situation you can find in this environment that they find with other users. But at the level up from that is what we call common houses, but with facilitated socially. That can be small houses, at the outskirts of the town, but also congregate houses that is facilitated when it comes to what kind of people that are living in the neighborhoods and so on. And also we have congregated houses without and with staff, with people put together. Some of the users actually want this kind of apartment because it gives them security and also access to the helpers. And at the top, you have the institutions and nursing homes. I think most of the outreach teams we have today are working with all these kind of social housing solutions. But it is a tendency to, when we are talking about the last group, that it's difficult to find solutions for in Norway these days. People are talking about we need more congregated houses and also houses with staff, because these users have so many problems, so multiple problem issues, that we need something else than the normal situation. But that's not what the users themselves are telling. Some of them, of course, wants this kind of apartments, and many of the users say, no, we need a normalized situation also when it comes to housing. And I think it's right to say that we have quite poor traditions of social mixing of people in Norway when it comes to, facilitate social housing. The survey I talked about earlier on, Brukerplan, which is a mapping of all service users with mental health or drug addiction problems in the municipalities. So it's something all municipalities in Norway more or less are doing. So this gives us a good overview over the situation. And this tells us that not only homeless people, but many other users are experiencing a deeply unsatisfying housing situation. So the target group with severe drug addiction and or mental health problems, 45% of them says that they have an unsatisfying or homeless situation. And that's quite alarming. But we also find a lot of people in the other groups, moderate drug addiction and severe mental health problems, tell us the same. A little bit about this Brukerplan, this mapping that we have in Norway. It says something about the functioning level of all the users, the service users you can find in the municipalities at 8 dimensions. Social housing situation, activities, economy, physical and mental health, drug addiction, social functioning, and social network. So it says something about their lives. And all users are have some kind of assessment when it comes to how are they functioning in these different kind of living conditions, living areas. And to summarize it, it says that when it comes to people with moderate drug and mental health problems, many of them have what we can say is comprehensive and severe lasting problems. Very few of these people have scorings that actually tells that their problem are minor, easily to deal with. You're talking about people with a huge amount of problems actually. And as you can see, when it comes to red and purple, we're talking about severe and lasting comprehensive problems. And the purple, you will find a lot of people also in the purple category, especially when it comes to several drug and mental health problems. We're talking about an alarmingly severe and comprehensive situation with problems. Just to finish out then, we can see on the scores that people are struggling a lot when it comes to activities with social isolation and also poor social functioning. And that's something the services has to deal with. And these people are quite low when it comes to the living conditions compared to other people. Both their income is from the social services, the connection with the other people is more or less from the services themselves. We're talking about people with a huge problem when it comes to loneliness. I finish with this. So, in my opinion, we still have some obstacles in Norway. There are resistance when it comes to social housing. People don't want this, people in the backyard, so to say. So we talk a lot about community integration, but actually we are experiencing a lot of community resistance. And also, I think homeless people are at the very bottom of the rank when it comes to who should get the council houses and so on, because people think that people with long-term homelessness are people with homeless all their lives, and we don't want that people in our neighborhood. That's something that's is there more or less as a taboo. But is it like this? In Norway, we have 110 council houses, and we have 1,500 people experiences long-time homelessness. In my opinion, you can also ask, this is a question of prioritization. So that's all from me. Thank you very much.